Childhood immunisation. Immunisation through the ages. The administration of a vaccine is called vaccination. One of the most common methods of delivering vaccines into the human body is via injection, the goal being the prevention of infectious disease. For this to be successful, it requires many children collectively over time to be vaccinated, as it is much more difficult for an outbreak to occur when there is herd immunity. The first vaccine to be officially developed was in 1796 by British Dr. Edward Jenner against the smallpox virus. Dr. Jenner was considered a pioneer, a founder of vaccinology. He took material from a blister of someone infected with smallpox and then used this sample to inoculate a 13-year-old boy. Dr. Jenner called this treatment arm-to-arm inoculation, and thus in 1798 the first smallpox vaccine was developed. Almost 100 years later, the first human vaccine was tested by Louis Pasteur, who we know today as one of the fathers of microbiology. His research led to a better understanding of how diseases develop and how they can be prevented. He laid down the foundations of hygiene, public health, and much of modern medicine can be traced back to the incredible breakthroughs this French chemist made over his 72 years. The main ethical controversies regarding childhood immunisation centre around mandates and objections. Some people have religious or philosophical beliefs that disagree with the vaccination of children. Informed consent. Children are too young to make their own choices regarding vaccination. Vaccine research and testing. Researchers and pharmaceutical companies have conflicting ideas and priorities when it comes to vaccines, as it is a lucrative money-making industry. The biggest controversy surrounding childhood vaccines undoubtedly belongs to Andrew Wakefield. In 1998, Andrew Wakefield published a study in The Lancet, claiming to have found a link between the MMR vaccine and autism in children. The next 12 years saw intense scrutiny around the possibility of a link between vaccines and autism. Many reputable studies were commissioned, and none of them could find any confirmation of Dr. Wakefield's conclusions. In 2010, The Lancet formally retracted the paper. 3 months after the retraction, Britain's General Media Council banned Dr. Wakefield from practicing medicine in Britain. The council also cited the link between the funding of Wakefield research and a group of lawyers who were hoping to sue vaccine manufacturers on behalf of parents and children with autism. Australia versus the world. Improvements of readily available vaccines, nutrition, housing, education, health, and governments putting legislation, rules and regulations in place have dramatically affected the decline and morbidity due to infectious diseases worldwide. For example, Australia has a National Immunisation Register, which also provides useful sources of information to the public on immunisations and timelines. Mass vaccination commenced in Australia in the 1950s. That has over time resulted in an overall decline of infectious childhood diseases. It has protected our communities from getting preventable diseases, including the vulnerable, and has lowered chronic disease. Infants and children need vaccination against many diseases, as this protects them while their immune systems are still developing. Other school-based vaccinations developed again in the late 1990s and early 2000s, when the Australian government funded a campaign called National Measles Control. In 1998, it was a catch-up campaign for all primary students aged 5 to 12 years of age. Since 2015, childhood immunisation in Melbourne is in accordance with the No Jab, No Play policy, as it adheres to the idea that immunisation from an early age helps protect the welfare of your children against serious childhood infections. No jab, no play means that you may not attend kindergarten, preschool, or childcare unless you have a valid vaccination certificate. The federal government enacted the Child Care Payments Act in 1997. Where if your child was not vaccinated, then this would directly affect enrolment or placement in childcare services, preschool and kindergarten. In Queensland, services were given the discretion to opt out of the vaccination requirement. Since 2009, the vaccination issue within Australia has been in the spotlight and saw a rise in extremist vaccination lobby groups such as Stop the Australian Vaccination Network, Immunisation Foundation of Australia, and Northern River Vaccination Supporters. The Northern River region of New South Wales has some of the lowest vaccination rates in Australia. There has been a rise in groups of parents and some health professionals creating communities, Facebook pages, printing materials, and creating parent groups at the local level concerned with the vaccination procedures, the quality of scientific evidence, the safety, effectiveness, and necessity of vaccination. Fears around vaccines. For many years, the issue of immunising children has been a contentious one. The majority of the general public recognise the benefits of vaccinating their children, protecting them against diseases in the current world and ones long since eradicated. But for a burgeoning group, the issue has become only fuelled by fear and worry about both the short and long-term effects. A 2020 World Health Organization article lists the most common fears for parents as being around the impact of vaccinations on diseases, which can easily be shown with examples like smallpox and measles, but is often countered with the argument that immunisation against hepatitis B has not eradicated it. Can vaccines actually cause the disease? A commonly spread misconception due to vaccines having an attenuated version of the disease. Is there long-term side effects, illnesses, or even death? Most vaccine-related incidents are mild and temporary, a sore arm or mild fever. Recent fraudulent reports that vaccines can lead to autism have been the most harmful, but to people with autism and to children not being vaccinated due to this. The link between diphtheria, tetanus, and sudden infant death syndrome. This theory came about due to a modern number of children vaccinated against DTP succumbing to SIDS, pointing to a causal connection. This is flawed logic and an anomaly. In the first world, the eradication of most diseases had led to the theory that children no longer need to be protected against them. However, these diseases can be quite prevalent in other parts of the world still, and it is still important to immunise against them, lest they rise again. You can't have herd immunity if the herd is dead. This is quite polarising in the general community and can cause rifts between families and friends. A recent rise in the return of old diseases could be potentially disastrous if these fears are not addressed. The effects of these vaccine fears on healthcare workers have not been small, with a need for continuing further public education putting a strain on already limited resources. However, many healthcare workers, with nurses in particular having been viewed as having a positive effect on the discussion. When questioned, parents have expressed that healthcare workers provide balanced information delivered simply in an environment flooded with so much information for and against vaccines. Due to this, healthcare workers should and do continue to expand their efforts to build honest and respectful relationships with parents and families. Individual choices. Often healthcare providers, such as nurses, are responsible for educating parents on the benefits of vaccinating their children. Parents' mistrust and hesitation for vaccines may cause pressure on the nurses and may as well be the greatest challenge for a nurse to overcome. To do this, further consultation for parents by nurses are introduced to go through vaccine ingredients and benefits. In today's day and age, there is a lot of misinformation about vaccines around. Communities of like-minded individuals band together to create echo chambers, where their opinions are right and everybody else is wrong. This is especially true with vaccines. They are such a controversial topic in today's society, and nurses have to deal with the willful ignorance of the everyday person each time they sit down to talk about vaccines. Healthcare system's goal is to lead parents to move from vaccine refusing to vaccine accepting. As a result, nurses are at risk to be mistreated and questioned for their effort. Berry's experiment in 2017 shows early learning teachers and nurses may be mentally abused by anti-vaccine parents when their children are excluded from daycare facilities due to lack of vaccines. Ethical frameworks. The practice of nursing occurs in a broad variety of environments and under a range of circumstances. It requires the assessment and treatment of individuals from differing socio-economic backgrounds while ensuring compliance with organisational, industry and government legislation. It is a complex environment to practice within and requires the nurse to exercise judgment in the delivery of every service to ensure ethical decision making is the basis for any assessment or treatment offered to any individual. The Nursing and Midwifery Board of Australia has published a national framework for the development of decision-making tools for nursing and midwifery practices. The 2012 Code of Ethics from Nurses, written by the International Council of Nursing, provides guidance for nurses outlining the four following elements. Nurses and people. Responsibility to the patient. When vaccinating children, the roles and responsibilities of those administering the vaccine and the training, skills, authority and competence of the nurse, the ability to complete the task autonomously or with supervision, along with the ability to comply with responsibility surrounding accountability and reporting related to the task. This issue extends to providing vaccines to children, as the nurse's role extends beyond delivery of the vaccine into the immediate aftercare. Immediate aftercare and procedure is inclusive of, but is not limited to, appropriate disposals of sharps, bandaging injection sites, and providing observation of the child for at least 15 minutes after the procedure to ensure no adverse reactions occurs, while educating the caregiver of appropriate in-home actions should they be required. Immunisation providers must update clinical and the child health record after delivery of vaccines along with the Australian Immunisation Register. Additionally, in the event of an adverse reaction occurring after the vaccine is delivered, in Victoria, that must be reported to the Surveillance of Adverse Events Following Vaccination in the community, SafeVic. Nurses and practice. Scope of practice. When deciding to vaccinate a child, the activity should be weighed up against the NMBA National Framework and the ICN Code of Ethics to ensure it is included in the current scope of nursing practice, that any relevant legislation requirements are met, and that provisions of care pertaining to the activity are following nursing practice standards. In a position statement issued by the NMBA, the role of the nurse is supporting the practice of vaccinating children is very clear. All nurses are expected to play a significant role in immunisation advocacy and delivery. Nurses and the profession. In relation to providing vaccines to children, the employing organisation must have adequate infection prevention and control measures in place, including but not limited to hand hygiene, PPE use where required, handling and disposal of sharps, routine cleaning of work environment. Basic equipment, including but not limited to the vaccine, which can be reconstituted vaccine requiring diluent, a vaccine from an ampule or vial requiring a 2 or 3 ml syringe, or a vaccine in a pre-filled syringe, a sharps container, a drawing up needle, dressing for injection site, and an anaphylaxis response kit, pertaining to the actual activity and effect cold chain which relates to the transporting, storage, and handling of vaccines. Nurses and co-workers. An important issue to consider when applying the NMBA framework or Code of Ethics to childhood immunisations is that the decision to provide vaccines to children are often made after in-depth consultation with the individual, their immediate family or caregivers, and any other relevant healthcare provider. That a full assessment of the individual's health history reveals need for the action. Example, acquired immunity to the chickenpox negates the need to receive the vaccination. Risk identification and management strategies must be implemented prior to any action occurring. Example, when vaccinating a child who is an immunosuppressed transplant recipient. The frameworks of ethical decision-making for nurses and the ICN Code of Ethics for Nurses are both as relevant to the issue of childhood immunisations as they are to any other area of nursing practice. As outlined by R. Lewis, M. Zaffron, and B. Melgard, the primary objective for a given immunisation program could be to save lives, prevent premature death and disability, improve the ability of children to learn, reduce health sector costs for hospital care and economic loss to society from absenteeism, or any combination of these, and other possible objectives according to the burden of the disease and vaccine in question. 2008 International Encyclopedia of Public Health. Thank you for listening to our presentation on childhood immunisations. This final slide here has a list of all the references we used in order to find the information today.